Welcome to the 7th hearing of the Public Accountability Committee's inquiry into the government's management of the COVID-19 pandemic. The inquiry is intended to provide ongoing parliamentary oversight to the government's response to the unfolding pandemic. Before I commence, I'd like to acknowledge the Gadigal people of the Eora Nation, the traditional custodians of this land, and pay my respects and those of the committee members and witnesses here today to those elders past, present and emerging. Today we'll hear evidence from witnesses from the health portfolio, including the Minister, the Honourable Brad Hazzard, Dr Kerry Chant, the Chief Health Officer, and Ms Elizabeth Coff, the Secretary of New South Wales Health, Dr Nigel Lyons, the Deputy Secretary, Health System Planning and Strategy, and Ms Susan Pearce, the Deputy Secretary, Patient Experience and System Performance. New South Wales Health has been instrumental in informing policy interventions from agencies and departments right across the government. Agencies continue to be guided by New South Wales Health and the expert advice of its senior officials, both as the pandemic evolves and as restrictions are being eased and reconsidered. Public health orders have been amended, updated or superseded by new orders based on how the state is tracking in relation to COVID-19 infections, and with a view to balancing the economic considerations with the ongoing need to control the spread of the virus. As we enter a new phase of the pandemic, restrictions are being eased, but we're also witnessing a spike in new infections in at least one other state. It is more important than ever that the public has full confidence in the state's health authorities in navigating us through this new phase of the pandemic. It is with this in mind that we now embark on our 7th public hearing for this inquiry. I'd like now to make some brief comments about the procedures for today's hearings. Today's hearing is being broadcast live via the Parliament's website. The transcript of today's hearing will be placed on the committee's website when it becomes available. I would also remind media representatives that you must take full responsibility for what you publish about the committee's proceedings. It's important to remember that parliamentary privilege does not apply to what witnesses may say outside of their evidence at the hearing. The guidelines for the broadcast of proceedings are available from the Secretariat. All witnesses have a right to procedural fairness according to the Procedural Fairness Resolution adopted by the House in 2018.
Hear, hear.
There may be some questions that a witness could only answer if they had more time or with certain documents to hand. In these circumstances, Minister, witnesses are advised that they can take a question on notice and provide an answer within 21 days. It is perfectly acceptable to provide an answer in less than 21 days. I remind everyone here today that committee hearings are not intended to provide a forum for people to make adverse reflection about others under the protection of parliamentary privilege. I therefore request that witnesses focus on the issues raised by the terms of the reference of inquiry and avoid naming individuals unnecessarily. All witnesses from departments, statutory bodies or corporations will be sworn prior to giving evidence. Minister, Ms Coff and Ms Chant, I note that Ms Coff and Ms Chant, you're on your former oaths and or affirmations, and Minister, you don't require to be sworn having taken an oath of office. So both Ms Pearce and Dr Lyons, perhaps starting with you, Ms Pearce, if you could please state your full name, your position, title and agency, and then take either an oath or an affirmation.
Thank you. My name's Susan Pearce, Deputy Secretary, Patient Experience and System Performance, New South Wales Health. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Thank you, Ms Pearce. Dr Lyons.
So, Nigel Lyons, I'm Deputy Secretary, Health System Strategy and Planning. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Thank you, Dr Lyons, and thank you to all of you for the work you've been doing and for your attendance at today's hearing. Minister, Dr Chant, did either of you want to start with a brief opening statement?
I'll just update the committee, if you like, on where we're at today. It's normal that we would bring the community up to date at about 11 o'clock. So as it's now just after 10 and we're in this committee, I think it's appropriate that we give the update to 8 p.m. last night. New South Wales continues to do extremely well, and I want to thank the community for that. It's only possible to achieve good outcomes when there's a partnership between the government, New South Wales Health and the community, and our community has clearly been listening to the messages since the last week of January, because we've certainly had a very positive outcome. To 8 p.m. last night, we had 7 additional cases. Not one of those cases was local transmission. all of today's new cases were travellers in hotel quarantine, which again stresses the importance of the hotel quarantine initiative. The committee would be probably aware that in the early stages, states and territories approached quarantine on the basis of it being in people's homes, and obviously there was a certain paucity to that. So steps were taken to ensure that people who are returning travellers are able to stay in hotels under supervision, and that's worked extremely well. Those 7 additional cases in the 24 hours to 8 p.m. last night takes the total number of cases in New South Wales since this outbreak occurred to 3,184 cases. In the last 24-hour period, again, we had an extraordinary response from the community. It's unusual to get extremely high numbers on the weekend, but to get 11,833 tests being undertaken indicates that our community is certainly responding very well, keeping in mind that that was a Sunday, so it's very good. We've now had a total in New South Wales of 842,374 tests since the outbreak of COVID-19. So on that basis, we're heading very quickly towards the million mark. Keeping in mind there's only about 8 million people in New South Wales, that's extraordinary in just those 5 months. We have 2,784 people who have recovered from COVID-19 in New South Wales. And I'm very pleased to say that again, and now for quite some time, there have been no deaths reported. We currently have 53 COVID-19 cases being treated by New South Wales Health. Pleasingly, none of these cases are in our intensive care units. So in other words, none of them require ventilation. 94% of all of our cases being treated by New South Wales Health are actually non-acute out of hospital care, so they're not actually in hospital. Thus far, there's been 1,870 cases that were acquired overseas. 69 were acquired interstate. 881 were locally acquired from a confirmed case or a known cluster. And 363 were locally acquired from an unknown contact. There's only one case currently under investigation. I stress that the clusters and known cases are tracked down or traced down by a very professional team of people that have been now obviously very experienced in this. And that's been one of the big advantages we've had here in New South Wales, that it may have been a tough few months back in March, or tough couple of months in March and April, but we have very experienced people doing the tracing. And we're able to make sure that we can effectively, as far as is humanly possible, break the chain of transmission. Since the 29th of March, 3,391 symptomatic returned travellers have been tested in our hotels, with 107 of those, 3%, being found to be positive. Travellers are topical at the moment. The travellers are also screened at day 10 of quarantine, and there's thus far 12,167 returned travellers have been screened on day 10 of quarantine, and 64 of those were found to be positive. I think it's safe to say that the additional steps that we've taken, which will become effective today or tonight at midnight, of requiring reluctant participants in the testing at day 10, they'll be required to stay for another 10 days. The logic of that is they have another 4 days, obviously, after their 10 days of the usual 14-day quarantine period, but then there'll be another 10 days, so they'll have effectively another 14 days of quarantine. The reason we made that decision, even though we have a very small number of reluctant participants, is that it's far better for us to know exactly what is happening before they are released into the community. We've had no major problems of it, but we're not prepared here in New South Wales to run the risk. And I think the step we took in announcing that on Friday has now been adopted in Queensland as well. And I think I've heard this morning that Victoria has also adopted it. So it's pleasing to us, particularly knowing that the Victorians are doing that. The committee may be aware that there's been some minor cases in the last few days. There was one at Camden High School, so the school was closed. We're still following the same practice. One of the very good things that's occurred, if anything good can come out of a pandemic, is that we've been learning as we go, 1 in 100 year event. And the decision that seemed so difficult at the time when we had our first case of a positive in a school, and that is to get the school closed, deep cleaned and move on, it's been very successful. So Camden High School was closed on Friday after a member of the school community there tested positive. And at the same time as we were doing that, we were also doing something else we've learnt, and that is once there's a positive case in a school or in a local community, if we name the actual suburb, we find that the community are far more responsive to coming to the testing. So we had pop-up testing at Camden as well. You might remember we had a similar event up at Hawkesbury not that long ago. Instant response, pop-up testing. So there are many more things that I could go into with you, but I think that I don't want to take up the time of the committee to be able to ask whatever matters are of particular interest to the committee. And perhaps I can give more information as we go through, if that's adequate, Mr. Chair.
That is. Thanks for the update, Minister. I'll now hand over to the opposition and the Honourable John Graham.
Thanks, Minister. Thanks, officials, for joining us. I might also recognise that things have gone well on the health front and join with you on thanking the officials for their hard work and the community for their cooperation. Minister, I might start by asking you to address I think the key issue here. How prepared is New South Wales in the case of a Victorian-style second wave?
Well, first of all, I'm not sure that it's fair to say that Victoria is having a second wave. I think that's a term that is not particularly acceptable in the current environment by public health officials.
What's the term you'd use?
Well, they're having some challenges around clusters and family groups. Victoria has had low-level continuing issues now for many months. And that's not something that we have seen. We obviously had our peak we had 211 or 212 cases on the 27th of March. And since that time, we had a similar peak actually that occurred in Queensland. Our public health officials have been extremely responsive from the learnings that were had really in the space of 6 weeks, from the end of January through to 27th of March, 8 weeks. And that's been applied as we've moved forward. And I was just talking about some of those responses. I think the two cases are not analogous then, because New South Wales has had a different trajectory of transmission. Victoria has had, unfortunately, a bubbling along, if you like, of 10, 20, 30 and so on cases as they've gone along. And I think they're having a challenge at the present time within particular family groups and within particular multicultural community groups. And hopefully they will be able to manage that. I think, as I've said many times now to the New South Wales community, it doesn't pay to be cocky. It doesn't pay to be overly certain of our position. And we've offered help to the Victorians, as has the Queensland Labor Government. Stephen Miles, the Minister there, has also offered assistance from our point of view, and as I should say, also has the Liberal governments in South Australia and Tasmania and the Labor government in the ACT. We've all offered assistance to Victoria through a number of measures that we have learnt are crucial. One of them was to send a senior experienced public health official, a very experienced doctor, down there to their team to assist. Another major step, we have, as I said earlier in the first address, we have a very effective and experienced tracing team. Tracing is so important, but you need the experience and the knowledge of how to ask the right questions when you get a positive contact, positive outcome, because you need to be able to dig in and inquire as to where they've been, who they've been in contact with, and know the right questions when you get perhaps amorphous answers, answers that aren't quite clear. You've got to keep digging. So we've offered them our tracing teams as well.
Minister, thank you very much for all of that. We've got a number of specific questions, so I might just stop you there just for the moment.
Okay.
Can I just ask you, if we did see a spike in New South Wales, perhaps we can characterise what's happening in Victoria as a spike. If we did see a spike in New South Wales, do you have a threshold for reintroducing restrictions?
The restrictions that we have at the moment, which will be more or further freed up tomorrow, actually, tomorrow. Tomorrow the 1st of July? Yeah, tomorrow.
Wednesday.
What's today? Monday. Okay. Sorry, we've been working
Tomorrow
7 days.
midnight. Tomorrow
You're working
midnight.
7 days a week for the last 5 months. It all runs in one into the other.
Tomorrow
So it's
midnight.
Wednesday. We have certainly freed up our restrictions as we saw our positive transmission outcomes. But I think it's fair to say that this is public health and guidance by public health, which helps us helped us make the decisions as a government that we've made, as has been the case with the governments in WA, Northern Territory. All the Labor governments and Liberal governments have all followed the same practice. I think it's a case of we're watching very closely to see what happens in Victoria, and if we need to do any changes, we'll make them. But at the moment, we're happy with where we're at.
Okay, so can I ask Dr. Chant then, do you have a specific threshold that you would reintroduce? I mean, the Minister just spoke about how when those most significant public health orders were introduced in late March, there was a peak of over 200 cases in a
We've
day.
actually had a series of changes, though, you'd remember. So it's not just at that peak, it was over the period. And we've had, I think, a number of
The question
different...
is there a threshold?
Well, that's a matter that will be considered as we go through. And you can't expect to have a threshold at a particular time now when we've got down. If you're wanting us to, what are you asking us to do?
But is there a number, or is it the fact that there may be
it's a whole
locally
lot of,
acquired?
Is it the nature of...
Is
I'll
it
let
the
Dr
nature?
Chant have a go at that one.
What's the threshold?
So clearly what we look at is where the cases are coming from. So clearly our overseas acquired cases that are in the hotel quarantine don't present a problem for ongoing transmission threat. Similarly, if we have household cases in a closed institution, whilst we're very concerned about the outcomes for that institution, it doesn't necessarily reflect a risk for the broader community because of the containment action around a closed facility outbreak. In terms of locally acquired cases, we're most concerned when there are not where the cases are not identified and were occurring in people that were not in isolation at the time. So if we're seeing, because it may be that a person has acquired COVID-19, we rapidly identify the contacts of that case, but there has been the ability for exposure. As long as those contacts are actually in isolation at the time, we've then prevented that further spread. And the contact tracers will also now look back at where that initial person got it to also look at whether there were any other threads of transmission that we can detect and also break down, so unrecognised illness. And as the Minister said, that's why we often call for the community to come forward. We do a lot of testing, even around a single case that is locally acquired. So we look at the characteristics associated with it, whether they've occurred in cases that are in isolation, what the results of testing is. Obviously, if we've got a very big testing response and we know we've got penetration across all age groups. So one of the challenges we've got is that the disease, we've sometimes struggled a little bit more, even though we've got high testing rates in that 18 to 29-year-old age group. So we've got to keep getting that group to keep representing, because we also know that they're often the group that has had the highest disease burden. And they also have milder disease in general. And so you may not see, it could be transmitting under the surface and not pop up. So that's an important element. So I would be looking at all of those characteristics, putting that picture together and providing advice.
Thanks.
We've certainly considered, so that's probably a
Yeah,
start.
no, that's very helpful. Thanks, Dr. Chant. Minister, I wanted to come back to you. Has you been asked to provide advice on a possible border closure with Victoria?
Sorry, by whom? Every journalist in New South Wales has asked me that.
I should ask.
And occasionally Labor Party members suggest that. Who?
I'm not suggesting that, but I'm asking whether you have asked New South Wales. Well, then I'll ask Dr. Chant, have you been asked your advice on whether we should pursue a border closure with Victoria?
It's not. That's an issue for government to determine. Public health provides the public health issues which Dr. Chant has just recounted. Each of the closures, I mean, the Queensland Government, Premier Palaszczuk made that decision. The WA Premier made that decision. Each of the governments make those decisions. Public health's role is to give guidance.
But I think I think the question, Minister, is what's the public health position? What would be the public health benefits or detriments if there was a closure with the Victorian border, given the current circumstances? I'm pretty sure that's the question.
They don't address that. They address the issue of the public health transmission issues, not closing the border. The border is government's decision. That's why we're the government.
But surely you wouldn't make that decision unless you understood what the public health advice impact would be. And that's the question. What would be the public health impact, benefits and detriments of a closure of the border? That must be the kind of thing that Dr. Chant, you were able to give advice on.
She would give the public health issues without necessarily considering the sorts of issues that each of the Labor and Liberal governments have considered. So economic issues, what's the single biggest issue for example, the economies and mental health. Those are issues which government has to weigh up.
Minister, I think you're pushing against an open door. But the question is that there are complex issues on the border closures go well beyond public health. But the question is, what's the public health? And I think it's a fair question that it would be good if we could get Dr. Chant's response to. What's the public health position on it?
I've already just explained all the issues that she goes through, so I'm not
Well then,
quite sure.
Minister, can I just ask you one specific question before I pass to my colleague, which is, have you sought advice from the Department of Health specifically on the issue, on the public health benefits of a possible border closure with Victoria, given this most recent spike?
Not specifically on the closure, but every aspect in 5.5 months that you could possibly ask about, I've asked about, and more. But I weigh it up and weigh those issues up in the context of all of the other factors that government has to consider.
I understand that, Minister. I just wanted to know whether you had specifically sought their advice on the public health benefits of a border closure with Victoria.
Well, I think that question's now been asked 4 or 5 times.
No, but I think
the answer
Minister,
has
I might move to some other specific measures. How prepared is New South Wales for a second wave, a spike, if you prefer that term? We're testing flights and passengers that are coming into Sydney internationally.
We're doing more than that. They've been
What
locked up in a
consideration
hotel.
is there to doing that
Sorry?
for passengers from Melbourne?
Say that again.
What screening are you considering for passengers coming from Melbourne, returning from Melbourne, given the spike in Victoria? Is that under consideration?
Everybody that gets on a plane is actually temperature tested down in Victoria, so they wouldn't be getting on a plane. Qantas is actually, and Jetstar are obviously doing that. At this point, the advice from Public Health, well, actually you can give the advice if you like, Kerry, but Dr. Chant, because obviously at this stage, that's the advice that we've accepted, is that, and I'll let her give the advice.
So we urge anyone that's returning from, first of all, we're discouraging any movements out of the hotspot suburbs in Melbourne. Please do not leave Melbourne. And we are, so that's point one. As is Victorian Government, to some extent messaging some of those issues in relation to those suburbs. And I know the situation is evolving, so also we're working very closely and monitor the situation. We're also...
So I'm aware of those steps. What I'm asking
I'll
is...
take
the point of order. No. I'll take the point of order.
I've heard it and accept it. I do think Dr. Chant was in the middle of providing an answer and coming back to address your question, John.
So our approach in New South Wales is just to make testing very readily available. So on our website, we have a large number of COVID testing clinics which are scattered, provide free testing for all. So our main point to the community in general is to make sure that even with the mildest of symptoms, you present for testing, and that you actually don't go out and about if you've got symptoms compatible with COVID. And that's a very clear message we need to get. And it's a clear learning from the Melbourne experience that we still have to be very cautious. We're seeing an upswing in rhinovirus, which indicates the fact that some of our behaviours, our attention to hand hygiene, our behaviours are not going out and about.
In New South Wales.
This is in New South Wales, and that's an indicator because it's spreading the same way.
And I do have some questions about testing. That's the next measure I'm going to move to. I just want to ask the Minister, you've said screening is occurring in Victoria. Is it being considered in New South Wales, in Sydney?
Dr. Chant's just giving you the answer.
As,
She's just giving you the answer.
well, it is
Look,
being considered or it is not?
John, we consider everything every day. If we weren't actually sitting here for 2.5 hours, we'd actually be discussing all these issues
All right,
as
Minister,
we do every day.
if that's your answer, I'll turn to testing. What capacity is there to surge the testing rates in New South Wales? So the current Victorian testing target is 20,000 tests per day. They've made provision for a surge to go to 25,000 tests per day. You've told us the most recent figure is just over 11,000.
No, that was 11,000 on a Sunday, John.
Well,
In Canberra.
11,000
Don't play for the cheap point.
acknowledging it's a weekend.
Yeah.
What capacity is there to surge testing in New South Wales?
Why do we need to surge it? We're actually doing a lot. We did 23,000 on the previous day.
Yep,
We're
I
doing,
understand.
we're
I've seen
doing,
that figure,
we're doing
yeah.
an extraordinary
So
job, the public health team.
What's the
We're
current...
doing, we have so much capacity that we've built up by using...
So talk us
initially,
through
going back 5 months ago, we didn't have the same capacity, but we worked with the not only the New South Wales pathology, but also Lavity, Henry Douglas Moir and others who... the private laboratories who are also contributing. And as a result of the fact that we have that capacity, we have offered Victoria, you cut me off before I managed to finish what I was about to tell you, we have offered to Victoria to give them 2,000 tests a day.
So we're providing 2 of the 4,000 tests they're picking up from other states, yeah.
Well, there's 2,000, there's 350 coming from
it's a total of 4,000,
South
yeah.
Australia. Well, it's give or take,
Yeah.
because the Labor government in Queensland, I think Steve Miles was telling me, I think they can offer 2,000. So each of these states and territories have been offering, the eastern seaboard ones, where it's relatively close to get the swabs done, have offered some. I think Tasmania has offered some as well to try and help the Victorians.
Correct. So, and is our testing target still 8,000 per day?
We have...
Dr. Chant was shaking her head.
Dr. Chant?
She has a propensity for doing that. It's either a nod or
Well, just making it clear, Minister, you probably couldn't see out of your peripheral vision.
No, but
Dr.
you
Chant
didn't
was
need to
shaking
tell
her
me
head.
because...
I'm going to get into trouble for nodding my head.
Dr. Chant, if you've been shaking or nodding your head,
No, I haven't.
can I say we are grateful for whatever contributions you wish to make. Continue.
So just in relation to the testing, we have, whilst we a while ago set an 8,000 testing target, we have certainly got capacity to up that, and it's been pleasing to see. I just calculated, if my maths is not incorrect, we did over 115,000 tests in the last seven days. So, but what we also look at is about the quality.
What's the maximum that we could surge to, though? That was really the question that I started. That I don't
in
feel
terms
there's
of
been
just
an answer to.
seeking whether we could surge to assist Victoria.
No, I'm asking in the case of a spike in New South Wales, what could we surge to? Victoria's
She's
made
answering
provision
that
for
question by
25,000.
saying, well, we've got some going to Victoria. She's trying to tell you what we...
when I was requested to look into this in terms of our capacity to surge to help Victoria, it was clear that we could surge by about 4,000 tests per day in relation to health pathology. And also our colleagues in the private sector indicated that they also had capacity to do additional testing
Yep.
in the order of around 2,000, and that was just calling some of the bigger private laboratories. So in essence, we have quite a good surge capacity. The
So
point
that
I
takes
was
us to what number?
Well,
What's-
can we just let her answer? She's giving directly relevant.
No,
Trevor,
Trevor, I
cut
think
her
that's
off.
right. But so there's an additional surge capacity of 6,000, and you're going to come tell us what the total capacity is,
Well, that
Dr.
was
Chan.
that request that I was asking, that advice was late last week, when in the order we were doing well over 15,000 tests in those days of last week. So when I made the inquiries on behalf of what capacity was, they were in the end of last week, and so at those days we were doing in the order of somewhere between 13 and 15,000 tests. So that was in addition. So we could have then surged again.
On top of that, yeah.
The point I was trying to make is that the things that we look at with the testing is the quality of the testing. Is it reaching all age groups? So we cut the data by age groups to make sure that there's not a particular age group. We also look by local government area to make sure that there's also good coverage overall, because
Understood.
one of the issues is that this disease can be mild in many, and hence if you do not have overarching testing across the state. So we closely monitor some of those indicators. We've
Yep, of
also
quality.
looked
And
at
Dr.
testing
Chan, are we
rates.
considering moving to the saliva style testing that Victoria is now moving to?
The saliva style testing is not currently necessary here in New South Wales. We're not excluding it.
Yeah.
But the reason
Case
why...
of a spike,
Well,
though,
can
would
we just
consider?
let him answer,
It's
John?
getting a bit tricky here, you guys. I mean, seriously, if you want to ask the questions, we're happy to answer them. It's a public health issue, but stop cutting us off. The saliva tests are more acceptable for a lot of people than the nasopharyngeal testing, because I don't know whether you've had one, but I have, and they're particularly uncomfortable. When you have the COVID test, you have in the nasopharyngeal testing, it's quite, yeah, you know you're having it.
I think the threshold is once your eyes water, they move to the next nostril.
Mine were. And I think the saliva tests are obviously a lot more acceptable. I mean, you've got your pen in your mouth now. You shouldn't be doing that, by the way.
Are you considering introducing them then?
Sorry? No. Well, we will consider it if necessary, but we've actually had very good responses, so we haven't had the same problem. Again, it might be within particular groups within Melbourne where they've had some challenges and they have to make it a little more acceptable. Is the saliva test as good? Well, there's some argument, as you would expect in the world of science and medicine, as to
Well,
whether
I'm
or not
asking.
it's actually
Yeah.
as accurate. But I mean, any test better than no test. I
Yeah,
would
but
put
it's
it that
not
way.
under active consideration at the moment. You don't consider that that's
We don't
necessary
have to
now.
at the moment. No,
Yeah.
we don't have to. Not excluding it, just don't have to.
You finished on that, John?
Sure.
Do we know about the accuracy of the saliva test as opposed to the nasal test? Dr. Chan, is there any data about which is more accurate?
Yeah, you go for it.
So in relation to the salivary test, it's not as not as accurate, and it does miss cases. So in a setting where we really want to detect cases, certainly we are considering all technologies, including self specimen collection, saliva. So we work with our colleagues to look at all of the methods we might need to employ. And could I just put on the record that the nasopharyngeal swabs are very quick and easy, and we do want to
Speak for
encourage the general public to participate in them, and we are trying to make it very easy to be testing. So I'm sure many people, it's a very
Well, I
quick
can say on the
procedure.
record it's uncomfortable, but extremely short.
Yes.
Extremely short.
Thank you.
So, yes, and very, very, it should be a very low threshold. What is the threshold that you're saying to the community about coming forward and getting tested? Because I know some people feel...
Anybody at all with any symptoms whatsoever. Doesn't matter. I mean, we had one rather unfortunate case where the person later on described it as having a scratchy throat, and that had some pretty terrible consequences. So if you've got any symptoms at all, anything that might be, you might think of it as a cold or a cough or a temperature, whatever it be, go and get tested.
Because I
And there's
know...
other criteria as well. Perhaps Dr. Chan, would you like to go through all the criteria?
So I suppose we are encouraging anyone with symptoms compatible with COVID to get tested. We are certainly messaging very strongly that if you're in any sensitive occupation, disability services, aged care, health, we are really stressing that it's absolutely essential that you get tested. And we're also messaging that if you, whilst our message is in get tested, but please don't go to work or any places, and if you've got a bit of a runny nose for a day, just don't risk it, because as I said, we are seeing the rhinovirus infections increase, and it means that people are probably being a little bit lax with those hygiene messages, and perhaps also attending other environments or going out and about when they've got those respiratory symptoms.
Can I just, for the record, Dr. Chant thinks we all know what rhinovirus is. Rhinovirus is one of the common viruses for colds, and the fact that it's escalating in numbers indicates that perhaps there has been a certain complacency creep into the New South Wales community to a degree. And so people are not actually going and using this as regularly as they should. They should be using that and washing their hands like there's no tomorrow.
Ms Ward?
Thank you, Chair. There's also another criteria, though, isn't there? Location. If you are in a location, for example, we saw the testing on the weekend with the case, and you suggested if you're in that community area, that you might go along.
Yeah, well, that's true.
As well.
But again, it's location, but combined with symptoms.
Yep.
The gentleman I think you're talking, well, the case you're talking probably is the one at Penrith, is it? Is it the one you're talking? Yeah. Well, there was a gentleman in his 70s last week who had, or late last week, who had. I think we announced it on Friday or Saturday. Every day runs into another. And so we encourage people in a particular suburban area, if there is a positive, to go and have it. It's a way of raising the awareness, if you like, of the community. That if you tell them, if I said to someone that we had a case in Sydney, well, everybody just say, well, okay, that's Penrith to Coogee. But if I said to them it was in Coogee, then there's a good likelihood that everybody in Coogee would think, if I've got a cold symptom, I'm going to go, or a cough or anything, I'm going to go and have a test. Yep. So it's part of the psyche, if you like, of making sure the community are hearing our message and responding where necessary. But it still requires either, as Dr. Chan said, particularly being in a very sensitive area like aged care, hospitals, etc., but generally having any symptoms at all, you should go and be tested.
And has anybody been turned away from testing? Because some people I know I've had discussions with people in the community, and they say, well, should I get tested with very minor symptoms? My advice is always, you should always get tested. No one gets turned away. Has anyone been turned away at testing and been told, no, you don't have symptoms? We won't test you?
I think it's fair to say that in some areas over the 5 months, people might think they go in and they say they have symptoms, and it's up to the medical professionals to determine whether or not they have. It's particularly, actually, David, in the early stages, back in, say, February and March, worldwide there was a shortage of test kits. Okay. You would remember all that media? Yeah. So there was a high level of sensitivity about... Sorry, Mr.
Perhaps I agree with you. What I'm talking about is probably now. We have no shortage.
But I've had cases where people have told me that, but... I haven't had a lot of them, but I've seen the odd case here and there. But by far, if it is, it's a minority. It's very rare.
So if in doubt, get tested every single time. Is that the advice?
Yes, it is, and very much that we want to make the testing experience easy. We're going to need people to come back. I mean, that's a really key message to get. Just because you've tested negative on one occasion doesn't mean...
Not a shield.
It's not a shield. Next time you get a respiratory illness, you've got to have another one. And we are going to need the support of the community, because those high testing rates are so critical to us understanding what is going on in terms of community transmission.
One of the barriers that people have raised with me about getting tested is the fact that once they get tested, they're self-isolating in accordance with the advice until such time as the result has been returned. And therefore, the whatever delay there is, and by delay, I don't mean that in a pejorative sense, whatever time frame there is between getting the test and getting the result, the shorter that is, the less resistance there'll be for people getting tested. What's the current sort of time frame for between getting tested and getting your results?
But when we were building capacity, I think there were some delays going back a few months. Some of the, particularly the private laboratories, sometimes get a bit of a backlog because they're also doing a lot of other work as well. But, I mean, I had one on the weekend. A lady spoke to me and she was tested at Northern Beaches Hospital on Saturday afternoon, and by Sunday morning she had the results. So
I had the same experience a couple of weeks ago. Tested on a Friday night and had the results by midnight.
generally you get it within a day. But there are exceptions.
But I suppose, Dr. Chant, what's your target? Because that delay and that self-isolation, which is entirely appropriate for public health reasons, is a barrier for some people to get tested. What's the target for reducing that?
But it shouldn't be, because absolutely everybody, no matter what the delay, should be tested. Because if they don't, they're not actually doing what we really need. We need every member of the community to be partners in this. This is a worldwide pandemic with many hundreds of thousands of people who have died. We can't afford complacency or excuses, and the community here in New South Wales must be with us on this journey. And yes, there will be from time to time some little delay here or something that might not be as comfortable there. But you know what? At the end of the day, we all have to have it, and we've all got to wait, because if we don't, we're putting the rest of the community in danger.
Minister, I agree with you. You're pushing against an open door on that. But the shorter the delay, the less that's going to be a concern for people, and the easier it will be to get mass compliance. So is there a plan, a target to make that delay as narrow as possible?
Well,
Dr. Chant?
Well, Dr. Chant.
So we do recognise this, and as we're, one of the strategic objectives now is to actually make the experience very consumer friendly, so we can actually get people coming back. So one of the components of that is getting the return of the results quite quickly. So we are trying to encourage more people to enrol in the SMS text messaging services, so that allows, and we recognise that perhaps that was a bit clunky initially, and so we needed to do some more support to allow people to enrol in that SMS. We're going to be working also with the private sector to just look at how the return of results can occur more swiftly in the private sector as well. But just be rest assured, we recognise the importance of getting that turnaround time down as quick as least possible. We're also working, health pathology is working at the logistics. So some of the issue is that the specimens need to be transported to a site, and that can often be delayed. Health pathology's mitigated that time delay by having point of care tests, gene experts, which are more rapid testing available in those critical regional rural where there might be quite a time lag, and so health pathology has put a lot of those machines out in more of the rural remote, because often the time delay there was actually getting the specimens into a centralised laboratory. So we are trying to address the issue, and I understand that members of the community have had some bad experiences, but we certainly are committed to addressing that.
All right, thanks, Dr. Chant.
Can I just say, David, the thing that Dr. Chant has swept over is there are different types of tests. I mean, obviously, John asked before about the latest one being mooted for particular reasons in Victoria, but there are different types of tests, and each one of those have different speeds, if you like, even if they're there. But also the issue that also Dr. Chant has swept over is if you're in a remote part of New South Wales, it might take a while to get it to a laboratory.
The physical transport of the specimen, yes. And that's why prioritising the more rapid testing to reduce that time frame for those tests that are coming from regional New South Wales.
Travel, so if we can,
There have been a number of studies about the efficacy of masks, particularly on public transport, and the evidence that I've seen seems to suggest that if there is a concern about locally acquired cases, that the use of masks can have a substantially positive impact on reducing transmission. What, if anything, is the public health position on the use of masks?
There are a variety of views on masks. Obviously, there's the P2 type of mask, and then there's the surgical mask, and then there's subsets of those as well. And I think there's a variety of views, like everything else in public health and science, as to whether or not they are particularly useful in certain circumstances. Clearly, there are some situations where they're very useful, but Dr. Chant, would you like to give them one of the discussions about masks that you're so good at?
I'm sorry to take you back to a dark place, but I think
the current Australian Health Protection Principal Committee's advice in relation to masks is that masks can be considered where social distancing is not feasible and you're going into crowded places where social distancing is not going to be able to be achieved. The thinking from a public health perspective is that masks are most effective for people that have got protecting people that have got symptoms from transmitting. So it's actually, and we know that there is just before symptom onset, people are potentially very infectious, and so masks can be useful in those situations. On the downside, we don't want people to fall into a false sense of security with the mask and not maintain the social distancing, the hygiene measures, and also people's wearing of masks. If you wear the mask day in, day out, the same mask, that's not going to be effective. It then presents risks if you're putting that mask down on surfaces and other things. So there is guidance that we're giving people around how to wear masks, the duration of wearing masks, and how to dispose of them safely. And we would be open if people want to wear masks, particularly if they're going into crowded situations where they're not going to be able to maintain social distancing. But we're strongly discouraging people going out and about with symptoms. We're suggesting they get tested.
That's one of the problems, that the core message has to be don't go out if you've got any symptoms at all. So if you're using, for example, the surgical mask and you do have some symptoms, and just say you have got COVID, as Dr. Chant has advised me many times, we tend to, as I just saw John doing with his pen on his face, we all touch our face 1,000 times a day, more than that. Even the experts have been trained in the use of PPE. So the problem is if you've got a mask that's actually got droplets inside and you're adjusting it, taking it off, moving it around.
Everything you touch.
You touch it, then you put your hand on the desk or the table or the public transport or wherever it's going to be, and then somebody else sits there. They pick it up, they've got the droplet. So it's not as simple, as I said, it's like everything else in health and science, it's not quite that simple.
Yeah. So I fully understand, and I'm glad we're amplifying the position, that a mask is not a solution if you have symptoms. If you have symptoms, you stay at home and you get tested. That's the first point. But let's just take a very practical example. People this morning and this afternoon will be going into and out of, say, Wynyard train station. Can be extremely crowded. We've all been down there at peak times. Should people consider? Well, I accept it's less crowded now, but it still is crowded at peak times. Should people be actively considering putting a mask on when they go down into something like Wynyard Station, where they can't avoid close proximity with large numbers of people for that interaction? Is that something people should consider?
So people should consider that masks can be used where social distancing is not effective, and that's a personal decision. The AHPC statement is in accordance with that, and as I said, it also provides the caveats how to dispose it, how not to reuse them, and the sorts of masks that give you the level of protection, because people also don't wear masks appropriately as well. So I think it's a reasonable thing to consider on a personal basis to use masks where you're going into situations where it is particularly crowded. But I would like to acknowledge the work that Transport has done. I think that's probably been one of the key attributes of the response, that our transport network has really stepped up to try and to implement COVID-safe practices, and I'd just like to acknowledge the work of Transport in doing that.
That being said, I'm sure I'm not alone in having caught public transport and seen the very large green "sit here" signs and seen them, ignored by other passengers on the bus and or train in quite frustrating circumstances.
People sitting next to you.
So do you think that there is a public health benefit in having a positive message to encourage people, particularly on public transport, to be wearing masks rather than just an agnostic, it's up to individuals? Is there a public health benefit in encouraging people to wear masks on public transport? What
just said is it's a balancing act, David. If they were wearing them properly and they weren't doing all the things that you were saying, and if they didn't think that it was an excuse to go out if they've got a few symptoms, possibly. I mean, you could go, obviously Europe, each country, each subset has different views on this. The states in America have all got different views. Mr. Trump's got views on everything.
It's changed by the hour.
Many of them are wrong.
Well, just to be clear, we're not validating those views here, are we, Minister?
Absolutely not. No. I'm just
So-
saying as a balancing act, so what you're asking Dr. Chant to be definitive, and in health I have learnt a long while ago it's very hard to be definitive sometimes, and I don't think she's going to be that definitive. But if you want to be that definitive, please do, but I don't think she will be.
I think it's suffice to say that we'll continue to assess the advice in relation to masks also in terms of the level of local community transmission, which is another component to it. At this moment, we're saying that people should consider the use of masks in settings where they can't socially distance, and it's a prudent, reasonable practice, but they should still adhere to the 1.5 and the hand washing and hygiene wherever they can.
Can I add to that? I mean, it depends. If people are going to wear, as Dr. Chant said, you've got one mask, and it's a surgical mask, and you take it with you in your pocket, you jump on the train, you put it on, stick it in your pocket when you get out, you're going somewhere else, put it back on again, you're getting on the next train, go to work, take it off, put it back on in the afternoon. No, it's not going to work because it has all the inherent risks to it. But if you go, for example, to most aged care facilities at the moment, and you're only going to be there because you get time-limited visits, then they'll give you a mask, it goes on, and you don't touch it. And you're only there for half an hour. Different ballgame. So there are different environments, different circumstances, and that's managed because there are people around you to say you shouldn't have taken that off, you shouldn't be touching it. But in a public arena, I think it's a lot more challenging. So the safe thing to do is just don't go on public transport, don't go anywhere if you've got any symptoms whatsoever, and that keeps everybody else hopefully safe as well.
Well, again, I just repeat, I accept that, the primary advice, but is there a potential, if we do see locally acquired cases, is there a potential to provide masks at those key points, at train stations, at those large gathering points, if it's considered, a potentially beneficial response to an outbreak of locally acquired diseases? Is that one of the options being considered?
I think one of the lessons in the COVID response has just been incredibly flexible in your response and just adjust to each situation. So, of course, we consider the full range of mitigations versus, enforcing, if there was local transmission, enforcing lower capacity numbers, being more stringent around the policing of those, all the way through to more hand hygiene messaging, all the way through to masks. So we will always have all of the full range of strategies and then look at the local situation and apply those to that situation.
Ms. Cunn?
I want to go to an entirely different subject, and that's the quarantining of international passengers. Is there anything to learn from the Victorian experience with regards to the supervision of those quarantined patients? I'm thinking of the security people and the like in these facilities. Is there anything that we can learn from what's occurred in Victoria? Because my understanding is that it's been a source of transmission in itself.
As Health Minister, I'd say yes, there is, but I mean also...
And I'm not seeking to be critical of anything that's gone on in Victoria.
Yeah, I'm just going to say that the public health officials, the government, I know it's popular to bag out other governments, but you know what? I think the government's been doing its best down there.
Yeah.
And I think the Health Minister and the Public Health team are doing their best. And I don't think it's helpful to be criticising or...
Well, that's certainly not what I'm attempting, and I'm sure you're not either.
I think it was more, are there any lessons to be learned, rather than a critique?
I think, rather than making a comparison to what's gone on there, I just say that one of the major, probably the major factor in my view, but I'll ask Dr. Chant in a moment, my view would be the single biggest factor was us putting people into a hotel in quarantine to make the difference in New South Wales, and to provide some level of security there to ensure they stayed and didn't go off for wanders into coffee shops. In the early stages of this pandemic, we obviously were requiring people to go home and quarantine, but going home was too much of a temptation for too many people. And I think the fact that people have been asked to stay in very good hotels, taxpayer expense, to keep the community safe and themselves safe, but have a degree of security there as well, has been the single biggest factor. So I think, it was good for us. All that, I'm not going to draw comparisons to Victoria. I'll simply say it was good for us.
All right.
Do you want to add anything to that?
I suppose just to say that I think I'd like to also acknowledge Susan Pearce and the leadership in terms of, oversighting from a health perspective, the quarantine situation and the cooperation with New South Wales Police. I think that some of the elements that have been really important is also to acknowledge Teresa Anderson, the CE of Sydney Local Health District, who's also set up we set up early in the response a health hotel, so that positive people that are detected positive go to the health hotel, and it also is able to manage more complex patients that wouldn't be people, returning travellers, who perhaps have complex health issues that were not suitable for managing in the hotel, in the existing hotel quarantine. I think whenever those things happen, it's always important that we reflect and look at and Victoria's shared some of the learnings with us. And that always gives us pause for going and rechecking the infection control, rechecking our protocols, making sure there's no complacency setting in amongst the staff and people are educated and trained. But I've got to say that it's been quite a strong feature of the response, and acknowledge the hard work that's gone into it.
Can I also, we've just acknowledged Susan Pearce, and she's sitting here. She has been incredible, worked extraordinary hours. But she also has been out at SEOC, and maybe we could ask Ms. Pearce to just explain. Is it a married name or not married name? I don't know. I've never asked that.
I'll confirm it is my married name. Yes.
Mrs. Pearce. I'll ask Susan anyway to explain what happened and the benefits of setting up the state emergency headquarters and how that translated into getting police involved. Perhaps you could explain that, Susan.
I think that'd be welcome, Chair. I might just ask that we start the timing after this.
We haven't started your time yet, John. You'll be pleased to know. This is the government's 15 minutes. Ms. Pearce.
Can I ask Ms. Pearce?
Yeah.
Will you elaborate on that, please?
Yes, look, we've been at the RFS headquarters there at Homebush now for the last few months, and working very closely with New South Wales Police and all of the other government agencies who are represented there, including Department of Community and Justice, Education, Transport, etc. I think that has given us an opportunity to ensure that any issues that we've identified over this period have been ironed out quite quickly. There's a great deal of collaboration that exists between all of those government agencies, and insofar as the hotels is concerned, obviously that has been a very significant joint effort between police, health and the Department of Community and Justice in terms of the welfare needs of people in hotels. Presently, we've got something in the order of 4,800 people still in hotels. That number does obviously fluctuate, but that level of endeavour does require a lot of collaboration between us. In terms of the infection control measures, again, we've needed to make sure that our police, security staff are well supported. There are daily huddles to make sure that everybody is well briefed on what is required of them. And I think that process...
Fully distanced huddles, I assume, Ms. Pearce.
Indeed. Of course.
Workplace, of course.
Even to the extent where, checking of various licences and cards, our staff know that that's not to be handled, etc. So we have really gone down to quite a very significant level of detail to make sure that those processes work well. And we do continue to learn every day around other examples that are happening not just in Australia but across the world. So I think that, to sum that up, there is a great deal of collaboration and cooperation that's existed across all of those agencies to deliver this result.
Thanks, Ms.
The point
Pearce.
that Susan just swept over there about the huddles, as you correctly checked on the social distancing, but there have been some problems in Victoria currently with the security people not properly being, apparently not understanding the full complexities of the use of PPE and the necessary aspects, whereas our people in the hotels have been well and truly trained up, and thus far it hasn't been a problem. I say thus far because anything can happen tomorrow, anything can happen right now as we're sitting here talking. But it has been differently handled, I think, and our public health units in New South Wales, working with the police and working with all the other agencies through that structure out there at Homebush. Most amazing facility. It's normally the rural fire headquarters, but being turned into effectively an HQ for all these agencies to work together has been miraculous in terms of the outcomes for New South Wales.
Thanks, Minister. Ms. Yusos.
Thanks very much, Chair. Minister, just a quick question. You or your department have told us that on the 26th of May there were 1,300 ventilators that were available for patients if required in New South Wales. Is that still the case? Is there an additional capacity? Where are we at today?
The issue of ventilators is part of the equation of trying to prepare our entire health system if the curve was as we first anticipated it might be. And a lot of work has gone into increasing the number of ventilators dramatically, at 2.5 times the number that we had originally, plus training up the ICU staff, or staff that can work in ICUs with ventilators and with all of the equipment that goes with it. But I'm going to ask Susan Pearce again to comment on that, because she has been instrumental in working with the team and also Minister Ayres, who's been part of our inner sanctum, if you like, to try and increase the opportunities for getting ventilators. One of the problems of getting PPE early on and ventilators and everything else that we needed, hand cleaner, was the supply chains were cut for the rest of the world. And so we had to find ways of actually getting the equipment either locally produced or finding alternative supply chains. So, Mrs. Pearce.
Thank you, Minister. As at last Wednesday, when we last reported on this number, Ms. Hussos, it was 1,419 ventilator-capable beds across New South Wales, including some beds in private hospitals, and that is as at last Wednesday.
And is that continuing to increase, or is that a number you're trying to keep stable now? What's the...
No, we continue to attempt to quadruple our ICU ventilated bed capacity, so we still have some ways to go toward achieving that. Of note, and this is good news for New South Wales, we haven't had a ventilated COVID positive patient in New South Wales since the 29th of May.
Okay, thank you very
What
much.
is, it's 1,300 now, did you say?
1,400.
1,400. So what's the target? What's a quadrupling mean? In terms of
At
the
least
target?
2,000.
Okay.
Yes.
Okay, thank you. Minister, at our last hearing you confirmed that 82 healthcare workers had contracted COVID. Can you provide us with an update on that one?
I might ask Dr. Chant to do that, because she's got all the details on that.
Thank you.
Look, I'll just have to, if you just want to, I'll get back to you if in this session, I'll just get
Of course.
that emailed to me.
Minister, can I just ask you, how long will the free parking and accommodation for healthcare workers remain in place?
There's been no decision taken on that, but obviously we took those steps to make sure that the frontline staff had those additional benefits. Also, as you would probably recollect, I think we talked about it last time, there was accommodation available too for some staff who might have been worried or were worried at the time. I think it's fair to say there's a lot less worry now in the health system at the moment, but as you just heard from Mrs. Pearce, we continue to step up every aspect of our capacity. So we'll see how we go, I think at this point would be the topic.
But it remains in place for the moment.
Oh yeah.
You spoke about...
Can I add, a lot of the councils have been really good on that front too. A lot of the councils where there isn't perhaps available parking have actually made special arrangements. I know the City of Sydney contacted me 2 or 3 weeks ago and said that they're making sure there are updated stickers or something on the cars of people that might be working at particular hospitals. So everybody's been really good on that front, trying to make sure the staff get support.
Excellent. So you spoke about personal protective equipment earlier and the early difficulties that you faced. Are you now confident that even if there is a second spike, that you have enough PPE for what's required?
I think that there are issues. Certainly, PPE consists of a number of different, obviously, items. One of the issues that we still have, I'll actually ask, who would know? Nigel. I'll ask Dr. Lyons in a minute to speak on that. But one of the issues was full masks. But we've actually got local suppliers now making those, so that's got a lot better than it was. Surgical masks, that was challenging because most of our surgical masks came in from Hubei province and Wuhan initially, and suddenly not possible. And again, we've got extra supply of that. I think one of the remaining issues was the fact that the gloves, there's 2 different styles of gloves that are used in surgical situations. and they're much more problematic because you've got to bring those in from overseas. We don't have capacity nobody has capacity, as I understand it, but I'll ask Nigel whether there's any update on that. But my last advice was there wasn't any provision for that in Australia, so we've got to get those from overseas. But Nigel, can you give us
So
a
there's
full...
no local provision of gloves, they all have to be still
All come
sourced
in from
overseas?
overseas, don't they, Nigel?
There are some gloves that are manufactured, depends on what type of glove you're talking about.
Nitrile or the latex?
And it's whether they're sterile or non-sterile is the other issue as well.
Yeah, all right. Well, you take us
So
through.
we're in a much better position with personal protective equipment. As the Minister said, it was very challenging early on with the global supply chains interrupted, and many of our normal suppliers were not honouring commitments to provide PPE that were
That's
in
because
place.
they're being paid more by other jurisdictions around the world. So as it started to hot up in Europe and the States, they were paying a lot more, so they just didn't send their gear to us.
It was like a global bidding war.
It was.
So Health partnered with the whole of government procurement process, which police were leading, and we've been fortunate to be a part of that whole of government as well as having our own processes for managing PPE. There's been 41,000 pallets of PPE that have been delivered and supplied to health and across government agencies in New South Wales since the pandemic started. We're monitoring the PPE, and the particular issues that there are so many different items, of course, as you'd be well aware, but it's very important that we have access to face shields, to face masks, to gowns, sterile gowns, gloves, P2 N95 masks. These are the things that keep our staff safe. So very early on, of course, there was a great deal of concern from our staff about being able to access the equipment they needed to provide care safely. And we set in place a whole range of initiatives to do that. And I think there were some hiccups early on as our supply chains were interrupted, but also about how we stepped up our management of PPE right through from procurement through to ensuring that it's available in the clinical areas where staff need it when they need it to care for a patient. And getting those processes and the management systems in place, transparency and visibility about what stock we had, ensuring that staff had an escalation process if they couldn't access what they needed within their hospital to ensure that they got access to it, they were all put in place.
So Dr. Lyons, can I just ask you how much of that proportionally, as a rough estimate, is now being sourced locally and how much is overseas?
Most of it's still being sourced from overseas.
Okay.
Where the supply chains, global supply chains have been reintroduced, but we have had some examples where we've used, again, things like hand sanitizer, which has been manufactured locally. I think we've had 2 million litres of hand sanitizer that was locally produced. There are some other examples where we've actually had face shields which have been supplied through local manufacture. There's been some face masks that have been also supplied through local manufacture. So there are examples of where we have actually accessed local suppliers for certain types of equipment at different points in time.
Minister, could I just ask about transparency on access to the national, there's a national stockpile or a national of PPE. I got a sense there were some frustrations about transparency about that at different times. Do we know how much is there? Do we know what the guidelines are to allow states to access that national stockpile?
And has it been replenished?
You'd have to ask Minister Hunt that.
Yeah, well, I'm asking from your perspective. Yep.
I think it's fair to say that New South Wales felt that we were not prepared to rely on anybody else except New South Wales. You heard a minute ago from Dr. Lyons that we had the police involved as well in the procurement. Assistant Commissioner Mal Lanyon was working with our health teams, and I have to say the Premier was incredible on this, because the Premier actually brought in, we were having meetings, 3 mornings a week, was it?
5 days a week.
5 days a week initially.
Then 3.
5 mornings a week to work through all these issues out at the state emergency headquarters, and there were a number of us who were involved in that, but we had people such as Assistant Commissioner Lanyon involved, and we also, the Premier suggested that we should get the private sector involved, so we had Rod McGeoch, for example, sitting in there because of his contacts with overseas. We had a number of different private connections to try and find ways around the supply chain issues. And I think New South Wales is probably the leader in the country in terms of finding alternative sources for us
But what was the
that's-
benefit or purpose of the national stockpile in all of this, Minister, is what I'm asking. We have that national stockpile. It seems to me that...
You'd have to ask Minister Hunt that.
Well,
the stockpile was there, but I mean,
could still be there.
maybe.
But
We think it is.
Was it useful? It doesn't sound to me like it was useful. It doesn't sound to me like it factored into your planning because you didn't know what was there. You didn't know what the access procedures were.
Minister Hunt gave us assurances that if we needed it, it would be available. But keep in mind there were different states and territories. I mean, we had a number of different states and territories at different phases of development of their of the COVID crisis, if you like. New South Wales in good times, or any time, New South Wales is the gateway to the rest of Australia. So we were getting a lot of people coming in here, and therefore we had a major issue in terms of the early response. And I think off that, we just learnt that the New South Wales Government was going to make sure that we were completely capable of managing this issue. And if we needed to, we knew we could ask Minister Hunt, and the Prime Minister was very helpful. Regularly, obviously, in national cabinet meetings, they're having those sort of meetings. But we found in the end that it was a better outcome for us to be independent. And I think that's what most of our community acknowledge, that New South Wales has largely led the country. Having said that, I acknowledge that every other state and territory health minister and leader have been extraordinary. And I've got to say, this is a period of my life where you'll never hear me say a bad word about a Labor health minister ever again around the country. Perhaps any shadow ministers here I will, but other than that,
Minister,
certainly not Labor ministers or Liberal ministers.
We've got some
hand back
limited
to the
time.
opposition now then.
There's no Greens
on that.
one, so I can't comment on that.
We have got limited time this morning. I wanted to come to the final issue on that I wanted to cover on healthcare workers.
Excuse me, I've got the
Got
healthcare
an
worker
answer for you.
data.
Oh, that would be
Healthcare
excellent.
worker
Thank you.
data. So, in relation to the reporting period up to the 21st of June 2020, there were 203 healthcare worker notifications. Now, it's important to note that those healthcare workers did not all acquire
So what were the numbers?
203 healthcare worker notifications. It's important to note that the majority of those, as in 34.5% or 70, acquired their infection overseas. 6 of those 3% acquired them interstate. 17 were household contacts of a confirmed case, 8.4%. Other contact of a confirmed case, 7, which is 3.4%. Linked to a known cluster outside of a healthcare facility, 14, which was 6.9%. And that left with a possible healthcare exposure in 88 people. New South Wales has established a process of reviewing all of those exposures to look at what was the mechanism of the exposure and what were any learnings that could be incorporated into the system in response to each of those cases. Not all of them are in the public sector employees in ours. They also are across all dimensions of healthcare provision.
Does it include aged care facilities?
Healthcare workers.
Healthcare workers, yeah.
Healthcare workers includes aged care workers, yeah?
Or healthcare workers as in registered nurses.
Registered nurses who may have been working
Who
in
may
an
have been
aged care
working in aged
facility.
cares.
That's just federally, obviously, but yeah.
Yep.
Or private facilities.
So it
everybody.
doesn't necessarily pick up everybody in an aged care facility, but if they are registered nurses,
They're a
then it
registered
does.
nurse under the APRA provisions, yeah.
Okay. Minister, I wanted to come to one final issue that has occurred since our last hearing, which is your government's decision to cut the wages of the front of all public servants, but in particular
That is just ridiculous.
Not estimates. It's not estimates.
workers.
That's opportunistic.
Don't you think there should be an exemption for workers, given that the incredible efforts that they've made on the front line during this pandemic?
Well, I'm going to take the point of order.
I think I said
I'm going to
before-
take the point of order, Minister.
Right.
This hearing is into the COVID response.
Well, I hear the point of order. I
It's
think the
not
Minister's in a
estimates.
position to answer it. So, and
More
I think
than-
it is covered by the terms.
Can I just say to you, that's disappointing. I mean, because you've actually got 5 senior health executives who could actually be out looking after the public health pandemic, the 1 in 100 years issue, and you brought them all in here and you're going to ask really banal political questions. The answer is I'm not here to answer those sort of questions. I've made my comments publicly. I support totally our health staff. I think they're fantastic, all the frontline staff. But I'm not going to get involved in matters that are now before the Industrial Relations Commission, but thank you for
Minister,
asking.
on that note, I might ask you about the Ruby Princess. Given that there's a special commission of inquiry, I won't dwell on this, but I do want to ask about
I think that was our position that we'd all
assessment
reached, including a
report.
discussion.
But I think
At this
I do want
committee.
to ask about an assessment report which was completed by New South Wales Health, which has been referred to there. It's titled New South Wales Health Report on the Ruby Princess cruise of 8 to 19 March 2020. Have you read that assessment report from New South Wales Health?
You may or may not be familiar, perhaps you aren't, Mr Graham, that there's a commission of inquiry and I won't be answering any questions whatsoever to do with the matter that's before the commission.
Well, I'm asking you...
I heard your question, I've answered it.
Yeah, well, I'm asking you a question.
I've heard your question, I've answered it.
Given you're a minister who's accountable to the
I've
Parliament...
heard your question and I've
I'm going to
answered
take
it.
the point of order now, Chair. The Minister has given his answer. There is a special commission of inquiry underway. This committee has had discussions about that and ask that you rule the question out of order and ask us to move on. We have health officials here who are prepared to and ready and willing and able to answer questions on the current pandemic.
to the
And this
point
is
of order.
clearly out of order.
Yeah, to the point of order.
Will we go and have a coffee while you guys argue about this?
Well,
Because I'm not
to
going
the-
to... You're wasting your time. Why don't you ask some questions about the relevant issues?
Well, can I say? Well, I think I've heard enough on the point of order to make
Well, no,
a
you
to make a
haven't
ruling
actually,
on it.
Chair.
Well, just allow me to
well,
make the
okay.
ruling. We have. I've clearly said earlier that we won't allow this committee to distract or to in any way take away from the independent commission of inquiry. But that doesn't mean that there is a blanket prohibition on questions relating to it. Members are allowed to ask certain questions, but I will definitely draw the line if it either dominates these hearings or in any way prejudices the independence of that inquiry.
Chair, if I may,
So-
my submission was not that it was a blanket prohibition. They're your words, not mine. My point was that this committee is to look into the health aspects. The Ruby Princess inquiry is a quite separate and distinct line of inquiry, which is being dealt with very thoroughly and capably by that commission.
So I've heard the point of order and I understand the nature of it. So at this point, I'm not going to rule the question out of order and I'll return it to Mr Graham because for one reason he didn't get to finish his
You've made your
question.
position clear, Mr Chair. He's made his position clear and I've made mine.
Yes, but I'm just going to allow the member
can ask,
I'm
but he's
going
just
to
wasting
allow,
his
I am, and I hope you will too, Minister, allow the member to ask the question and then we can
Asked it
assess
3
it.
times. How many times?
It's been answered.
I'm going to Mr Graham.
Minister, I simply want to know, have you read this report that was...
Well, I'll take the
prepared?
point of order now. That is the third time the question has been asked.
Why do you object to the Minister answering?
Because
He's capable of
in the
defending...
Sorry.
discussions I had with your opposition leader, we
Sorry.
dealt with what we were going to do with
So can I...
Adam had a clear position.
All right. Well, I'm going to step in now as chair. I don't want this inquiry. I don't want this inquiry to get distracted and to fall into this kind of fractious fighting. I think the minister has made it clear that regardless of how many questions you ask, the answer will be the same. And so I'd ask you to proceed to another line of inquiry.
Ms. Dr. Chant, I might ask you on that note that this question, on the 8th of May, the National Cabinet, advised by the AHPPC, signed off on a roadmap which included 3 stages to recovery. That's been quite helpful for businesses to plan. You participated in those national discussions. Why is it that we've been able to have a roadmap nationally, but we haven't been able to have one in New South Wales?
Well, hang on.
That's not a question for Dr Shanton, you know it.
That's
Point of
Well,
order,
it's-
point of
well,
order, Chair.
let me
The question
explain
should be
to
directed
you-
to the Minister.
Well, the minister's able to take it and he is taking it, so I'll allow the minister to answer it.
Well, the reason I'm asking Dr. Chant is you weren't participating in these discussions, Minister, but if you want to answer it, I'd welcome that.
We have managed the issue extremely well here in New South Wales and we've taken advice from Public Health and the AHPPC. But the AHPPC consists of the Chief Health Officers of each state and territory and from time to time some co-opted varying people who give particular advice and expertise on that committee. And they then give that information.
I'm aware of that, Minister, but the central question here is pretty straightforward.
I haven't finished.
That has been
I
very
haven't
helpful
finished.
nationally. Why haven't we done it in New
Point of
South
order,
Wales?
Chair.
I haven't finished.
Yeah, I hear the
Point of order, Chair.
I think it's well made.
Point of order. I haven't made my point of order. I asked that I be
I think the
heard.
minister needs to be allowed to answer the
I
question.
asked that I be...
The Minister needs to be allowed to answer
I
the
refer
question.
to paragraph 19 of the
And I accept
resolution
your
of
point
the
of order.
House that we have some procedural fairness and some courtesy to witnesses, and I just ask that we all take a breath and try and be constructive in our questions and in our answers, allow the Minister to finish the question and confine the question to the AHPPP, I'm sorry if I've got that wrong, the advice given in that context, not a political question, which should otherwise be directed, as you well know.
But I accept your point of order. The Minister, I think, was being directly relevant and was in the middle of answering the question, so I'll allow the Minister to actually complete the answer if you wanted to start again, Minister.
I won't start again, but I'll just say where I was up to is that the AHPPC has a variety of different states and territories at various, over the last 5 months, they've been at various stages of the development of the virus, the pandemic, and have different capacity to answer it. That is, how to prepare their way to answer the issues. And that information then went to National Cabinet. National Cabinet put down what they considered to be, if you like, the broad brush approach. But if everybody accepted that within each state and territory, they would not be doing what they needed to do. It needs to be, whatever comes out of National Cabinet needs to be interpreted locally for where they're up to.
I agree
and we
with
have
that,
interpreted,
Minister.
sorry,
Yep.
Mr Graham, we have interpreted, I think,
I'm
on
just trying to agree
everybody's
with you.
view, apparently except yours, we have interpreted it extremely well in New South Wales, which is why we haven't had a case in the last 24 hours again of a locally transmitted case. So I'm happy to
As
accept the
opposed to
advice.
75 in Victoria.
Well, I don't think interjections are helpful. The Minister's in the middle of answering the questions. Minister.
It's been made public, has it?
Yeah.
Yeah, I was, well, okay.
75.
And Victoria is obviously having a bit of a challenge, but
Yeah, so
again,
clearly
we're
we've
very
got a-
supportive of
clearly we've
Victoria
got a
and the Labor government there, who wouldn't be supportive of you, I'm sure, the way you're carrying on in this committee.
Oh, come on, that's
I
not
might hand to the Chair on that note.
You want to, okay.
Well, it's your time.
Well, we'll come back. Had you finished? Because if you had
I haven't finished, but I'm handing to you.
You sure? All right. Minister, I've literally just received some advice that there was an issue with the servers, New South Wales Health servers.
Sorry, David, can you say it again?
Yeah, I've literally just received some advice that there was an issue with the New South Wales Health computer servers. And apparently they went down for about half a day, for about 13 hours last week. Do you know if that did happen?
It's actually been in all the media.
Yep.
Numerous newspapers. It's what it was not us, not health. It was actually the data centre. There's 2 data centres where most government agencies operate through that, and there was a power failure, which then caused some grief for various agencies, including hospitals. And as I said, it was actually hospitals' use of particularly a variety of things, but medical records, for example. So for most of a day. I think it was last week, wasn't it? Or was it the day before?
Last
was it?
week.
Last week. It was about 10 days ago anyway, and it was in all the media. It was on TV, on radio, in the newspapers. It was no secret. And they had some issues where the doctors, for example, had to use paper records for the day until the data was fixed. What happened was that the data facility went down, but it also caused some grief with our servers, the health servers. So there had to be a part that I think was brought up from the Illawarra from memory. And again, that was all public.
Well,
Secret.
no, I wasn't suggesting a secret. It's just the advice that I had was that it was down for some 13 hours and that none of the COVID tests were able to be processed during that period.
There was a problem with pathology on that particular day, but as I said, medical records, pathology, and that gave us a bit of a backlog, but they caught up with it the next day or so.
Well, that's my next question. So first of all, are you sure you've found the problem so it won't repeat?
It was not a problem caused by health facilities or equipment. It was in the data centre that operates, managed by customer service actually, and it had a power failure, which can happen, and it blew up a part that then caused onset problems with some of our servers, and so it was fixed. I think the last hospital that came online was about 12, 14 hours later. It happened about 3:45 a.m. I think, on that whatever day it was. Is that right? I think
4 a.m.
Yeah, 3:45 a.m. And it took until the end of that day. The customer service technicians got their functionality back up. I think it was mid-morning or so, but it still had problems for our health services, not ours, health servers. and that was then resolved varyingly through the various hospitals over the course of the day.
Yeah, Minister, given how critical this infrastructure is, do we know what caused it, and can you assure us that it won't happen again?
No,
Because
I can't assure you that, because you know what's a big system. There's 400 hospitals, and these things can happen through the data centre, but we don't manage it. The data centre's not ours, so you need to have another committee inquiry and ask them.
No.
Well, no, but Minister, well, have you sought assurances from Minister Dominello?
Of course. And Minister Dominello was doing an extraordinarily good
I'm
job.
not asking him to fix the
as are all the
servers.
ministers in the New South Wales Government.
No, but do you know, are you comfortable that customer service knows what caused it and have taken steps to ensure that won't happen again?
They have assured me, and including I spoke to a number of different people. Obviously, I spoke to Minister Dominello, ministerial colleagues, of course I did. But I also spoke to the online technicians, the people in health who actually deal with cyber issues and computer issues, and I was satisfied that they were doing all they could.
Are you satisfied that there's sufficient redundancy in the system so that we don't see like one part, which is what happened here, just one part take down?
I asked all those questions, David. What do you think I do with them?
That's why I'm asking you.
And they told me
it seems to me there isn't redundancy. That's why I'm asking you.
The backup actually failed as well, so that's what happened. Okay.
Well, so
I'm not a technician. I'm not here to answer questions about that. If you want me to answer questions about, I thought this was about COVID-19. If you want me to answer questions about it, I'm happy to do it. But you know what? I'd rather get back to work.
Well, Minister, this is about COVID-19.
Asking dumb questions about a Royal Commission of Inquiry. You asking me whether I'm a cyber expert? Well, the answer's no. But I'm happy to take questions.
Minister, I've got to be clear. If the servers go down and you can't process the COVID-19 results and you couldn't do it for 13 hours, and the backup went down as well, well, that's a significant issue, and it's an issue about how we respond to the pandemic to make sure it doesn't happen again.
And we did respond.
So I don't think you should take this lightly or suggest it's a political point. It's a very real issue.
Oh, David, heavens. I went through all the things you'd expect a minister to do, and I'm satisfied the information they gave me was their best information, and I'll rely on that information. But I just remind you that New South Wales is handling the pandemic amazingly because of these incredible people sitting around this room, better than probably any other jurisdiction in the world. And you're asking me about cyber?
Well, because none of them can do their work if the servers shut down. And that's why I'm asking you these questions,
I've given
Minister.
you my answer. Do you have any other questions, or is that it?
Indeed, I do. What was were there flow-on effects to the public health response arising from the server outage?
No.
And there weren't?
No.
There were no backlogs? There was no delays?
Well, I just said to you, there was a delay in the medical records obviously had to be used in the manually. There was some delays in the pathology, but the results were up and running, I think, within 24 hours or 36 hours. Do you want to, I don't know what the point is, but do you want to answer the question?
Look, I'm just seeking clarification, but my understanding is the specimens were still being processed, as in the tests were still being performed. There was issues with the loading the results, but the process is that we would be notified immediately of any positive results from our laboratories. There may have been delays in just getting through the negative results and return of those, but that's my understanding of the situation. I would need to check. I've just seeking confirmation from Tracy McCosker, the head of pathology, but that was my understanding.
So we'll take it on notice and we'll tell you, but there's no great dramas, David, and can we get back to the questions we're here for? Because it's getting to be a bit of a waste of time.
Well, Minister, that's your view. I think
I'm
quite certain that people of New South Wales would be anxious about the servers going down and public health.
I can make a comment if you
Public health system not being able to respond.
answer your question, Mr. Chairman.
I can perhaps assist you.
Because I understand surgeries weren't able to be undertaken for those 13 hours as well. So, Ms. Pearce.
Our whole health system has business continuity plans in place for these events. So obviously when you're running a large system and a lot of that works with ICT, it is necessary to have manual processes in place. Some surgery was interrupted on that day, but by and large that continued across the health system, and we did also experience some emergency department delays that day, and you would expect to see that with such a large outage. However, it is not correct to say that no COVID tests occurred that day. Even during that period, the manual processes were enacted, and there were some delays that went into the next day in terms of that reporting and so on. But by and large, there were also large parts of the state where they experienced no delays. So you can't apply a blanket rule to everything that occurred on that day, because it was variable in terms of that impact. And manual processes were put in place to ensure that the work continued regardless of that power failure that led to the outage.
All right. Thanks, Ms Pearce. Minister, the now public news that there have been 75 locally acquired cases in Victoria, I see it doesn't come as a surprise to you, because what is the New South Wales Government response to that? We are coming up to school holidays. People are thinking about travel. What is the response to those 75 cases?
Well, clearly 75 cases are concerning, but I'm not sure they're all, I mean, it's only just been made public. I'm not sure they're all local transmission. I'd imagine that some of them would be overseas travellers as well. So I think your assumption there may not be accurate, but do you know?
So just to probably say that the Australian Health Protection Principal Committee has been meeting at 12 o'clock every day and did so over the weekend. At 12 o'clock today, we will be getting briefed on the situation by Victoria, and the purpose of the meeting was to be explicitly briefed by Victoria. So after that 12 o'clock meeting, I'd be able to be in a better position to update you. The things that we're looking at is whether there's been extending outside the cluster. So the advice is that the cases have been largely clustered within family groups, and there have been webs of transmission and linkages established between the various groups. I know that Victoria in itself is considering some additional actions, and so I will be in a better position to form a view about what it means after I've been briefed at that 12 o'clock. My colleague is joining that teleconference, given that I'll be in budget estimates, and I'll join as soon as I get out of this process.
So could we
Otherwise,
say
she could actually be doing the work she needs to do, but she's here doing this.
well, because actually being accountable is important in a democracy?
Well, yeah, but
Minister.
you've actually not asked any questions. I mean, it's a
Well,
public statement,
it's a
all right,
matter
so
of
it's come out now, but we've got to form a view on it. and it's just all a bit silly.
We are a week away from public school holidays. Will we get a very clear, unambiguous position from the government to say to people from New South Wales, don't go to Melbourne? Is that the unambiguous
already made
position?
that-
Don't
we've
go to
already made
Melbourne
that clear,
in any
but-
circumstances?
We have made it clear that, quite apart from today's latest results, that it would be preferable for nobody to travel to the hotspots of Melbourne. Indeed, I have said publicly not to go to Melbourne. In fact, preferably stay away from Victoria for the moment. Now, that makes me sad that I have to say that, because obviously people have families and so on, but it's the concern is we don't want families who may have family members and friends down there to be in those hotspot areas. But I've been saying that for at least a week, David. It's not like it's a revelation here at the committee.
But given...
Can we deal with something new or different?
Well, the question is pretty clear. Will you consider a formal public health order to actually not just discourage people, but to simply say you can't go to Melbourne unless, and you put in place a limited set of circumstances, similar to we had at the beginning of the pandemic?
We have actually been considering all matters that are necessary to be mattered within a public health response, and we will continue to consider those. But the advice at the moment remains, do not travel to Melbourne.
All right. And I want to be clear, the reason I'm asking you today on Monday is because I know, families are planning, plans are being made now. And I know your position is you discourage. But if we're going to get to a position of prohibiting, the earlier that's done, the better, because literally those plans are being made now by families all across the state.
I don't have anything else to add.
All right. John.
Thank you, Chair. Minister, I'll return to where we were on the questions about the roadmap. I understand the position you've just outlined about how these things flow down from the national sphere into the state, but businesses have found that national roadmap very helpful to get their heads around the changes they'll have to make. Why do we still seem to be stuck here in New South Wales, moving industry by industry, restriction by restriction, rather than setting out for the weeks or months ahead changes that might happen, not the timing but the stages, so that those businesses can plan what they have to do?
Triggers before. Jeez. Flop from one side
Well,
of this.
I'll take a point of order against you, Trevor. That's not helpful, and I'd ask you to
Haven't taken a
restrain.
point of order.
So we'll go back to the minister.
The floor is
Can I
yours,
just
Minister.
say, the question that Mr Shivers has asked is indicative of why you need to be considering the national roadmap but tailoring it to your local circumstances.
I agree with that.
And so we have done that, and it's been very successful.
But businesses are still saying, you must have heard this feedback, Minister, that they're struggling with the speed of these changes, not knowing what comes next. Why can't we do what happened nationally and set out ahead of time the various stages?
Nothing happens nationally. Nationally gives advice,
Yeah.
but each state and territory has made their own decision on how they will progress. And it's made on the basis of a real local knowledge about how our businesses, how our community and how transmission is occurring. And I don't see any problem with that at all at the present time. Having said that, obviously we are constantly reviewing all the circumstances, as Dr. Chant has said. Every day, that's what we normally do.
So let me ask you about one of those views from the National Cabinet then to be implemented by the states. On the 26th of June, National Cabinet agreed under Step 3 of the framework, states can allow small premises to apply a 1 person per 2 square metre rule with a COVID-safe plan in place. What's the plan for this particular measure here in New South Wales?
Again, I'm starting to think that nobody on this committee actually watches the media or reads the papers. I made it very clear on the weekend, more time than I've got, I think, but don't do anything with it. I made it very clear on the weekend that I'm not in a hurry, nor is our government broadly, to be rushing to those, but we will obviously consider those issues. We are considering them, but we will make our decision as we move forward. And right now, when we have other issues happening in effectively the larger position of what is an open border between us and Melbourne, those issues have to be considered. But I'm not rushing forward as Health Minister to put a time on when we might go to that. We'll make up our mind when we've weighed up all the factors.
So I've seen those answers, Minister, but isn't that a good example where businesses, I don't know if you've had this feedback, I certainly have, businesses are saying, look, we just have no idea of when these changes might happen. Nationally,
Businesses have to be on the journey with us as well. In Texas and Florida and other US states, they opened up very quickly and they've now got huge problems. The most challenging part of a pandemic is when it's easy to shut down, very easy to shut down. The question is, at what stage do you open up? And you do that by considering all the factors on each and every day, indeed each and every hour, as to what is happening.
It's going to be driven by the data, not an arbitrary timetable. Is that your position?
It's driven by the data and the advice of health as we progress.
Yeah, and that's accepted. What these businesses are asking for is some indication about what the stages
I've
are
answered the question
that we're moving through.
John.
I'll turn then to New March. I want to give you the opportunity to respond to evidence which has subsequently been given after you last appeared at this committee. You repeatedly put the point of view. I don't want to put words into your mouth, but really that this was a, I think it'd be fair to say you're arguing this was a national, not a state responsibility. Since that evidence,
I don't think I said that.
I'll put this view to you and allow you to respond. The Aged Care Quality and Safety Commissioner has said this: the public health services, as you know, which are funded and operated by the state governments, are the first responders in the main, and they're the ones who have the necessary expertise, and they therefore have very strong sway in relation to any clinical decisions being made at Newmarch. Now that contradicts on the face of it the position you put to the committee last time. I want to give you the opportunity to respond.
I will respond, but it's not what I said. It's your interpretation. Look.
Well, I'm simply putting that evidence.
Point of order. Look, the thing goes by a question being asked and then an answer, not a question being asked, the attempt at an answer and then an interjection.
I accept the point of order. And I say again, the minister needs to be allowed to answer the questions uninterrupted whilst ever the minister is being directly relevant. And two sentences into that, my 2 words into his answer, I thought the minister was being directly relevant. Minister.
What I said last time, what I'll say again, is that aged care facilities are regulated by the federal government and usually delivered through private or non-government organisations. In this case, it was Anglicare. Each of those people who were in that and still are in that facility, like every other facility, are in their own home. That's where they live. And most of them would have had their own GP. The normal occurrence is when you enter an aged care facility, you're asked who your GP is and will your GP continue to care for you? And the answer is generally yes. So most of those folks quite properly had their own GP. When the pandemic arose, of course, there were lockdown provisions effectively isolating aged care facilities as far as is practicable. And so some of those GPs were either not available or couldn't deal with the issue on telehealth, but most of them were. Most of the patients, residents I should say, were still being dealt with, as I understand it, by their GPs via telehealth. But when New South Wales Health, I should say, was asked for assistance, they were certainly made available, and in fact, James Brandley, a highly accredited infectious diseases specialist from Penrith LH or the PNLHD, made himself available and was there regularly looking after and giving advice on how the residents should be managed, where there was a need, in his view and on the medical views, to transfer the person to Napoon Hospital. They did. If they were capable of being managed within their home, then they were. And one of the big issues, of course, like everything else, as I've said earlier, it's a balancing act. A lot of folks who are in aged care facilities feel more comfortable if they're in their own home, and it is their home, and particularly those with dementia and so on. Any change can actually cause major other health issues. So all those issues are being weighed up by the clinicians, that is by Dr. Brandley and his team, and the decisions were taken at a clinical level. I'll ask Dr. Lyons, who has had a little bit of involvement with this, or actually quite a bit of involvement, I think, perhaps
Well,
give
Minister, where I might actually move on, I just want to give you the opportunity to respond
to give you information that you
evidence.
asked about.
Yeah, well,
and he's the Deputy Secretary.
I'd be happy to have that on notice. We've got a range
He's entitled to answer the question if he's...
I'm still answering the question because I've asked Dr. Lyons to answer the question.
I think people are entitled to move on if the answers have been non-responsive, but I think this is directly responsive. So, Dr. Lyons, if you have something briefly you could add.
Certainly. So there was involvement of the primary care response from the general practices and the primary health network. There was involvement, as the Minister has outlined, from the specialists who were part of a hospital in the home program for Nepean Blue Mountains, a local health district. So that included infectious disease specialist, a geriatrician, a palliative care specialist. There's also an intensive care specialist, and we provided a whole lot of infection prevention and control advice to support the outbreak, which was managed by Anglicare. But what it does highlight is that the tragic consequences of when COVID does get into aged care facilities, and that's been seen right around the world. It's devastating, and our condolences go to the families that were affected.
Mr. Thank you. Minister, you've referred a number of times during this session and previously and publicly to symptomatic testing. Why haven't we gone down the path of asymptomatic testing in New South Wales? The Prime Minister's flagged it nationally. Victoria is conducting asymptomatic testing. The AHPPC advice does recommend it in certain settings. When I've asked this question of New South Wales Health, they've said, look, we're not for broad-scale asymptomatic testing, but clearly 2 of the 5 priorities for testing do include asymptomatic testing. It doesn't seem to feature in New South Wales. Why is that the case?
Over the period of the 5 months, go back to what I was saying earlier, at one stage anyway, it wasn't necessarily a clinical availability because testing wasn't, testing supplies, testing kits weren't
Yeah,
there in great
understood.
numbers. But there's still a question of whether or not it's an effective area to target in terms of when you're trying to break chains of transmission. But I'll let Dr. Chant give you full chapter and verse on this and settle back. You'll be able to hear it all.
Sorry.
Off you go, Dr. Chant.
Look, the AHPCC, as you've read, supports basically a focus on symptomatic testing. That's going to be the most useful at detecting it, particularly in a setting where we don't have a lot of locally acquired cases. You can actually do a lot of asymptomatic testing for no
That's clear for those priorities.
No benefit,
Yeah.
and that's certainly been the experience even in Victoria that did do blitzes in associated with asymptomatic testing. They wouldn't have seen that as higher value as symptomatic. So the first thing we can do is get symptomatic people tested. But we have recognised the importance of asymptomatic testing in various particular settings. So in an aged care facilities, we now routinely, and we've done that quite in a number of settings, both asymptomatic and symptomatic people. So all the residents, if we had an introduction into an aged care facility, we'd test everyone. There's a few reasons for that. One is that in that setting, we know that elderly people sometimes don't display symptoms, so that they've already got underlying a bit of a cough or a bit of feeling fatigued. And so actually knowing when they've actually got COVID can sometimes be quite challenging in the early phases. And also we want to pick up the infection as early as possible in those settings. So asymptomatic testing as part of an investigation in aged care facilities as well as of staff is routine. We also have done that around schools. And so in our investigations of schools, we've had very low thresholds of testing. We sometimes also...
So how often is this being used in this?
So in all of our locally acquired cases, we would generally use asymptomatic testing as part of the tools to identify both the source of infection. So we do asymptomatic testing in response to any of our cases or consider its role. And we also use serology as well. So serology is important because it can help us. Not everyone has a serological, even if you're infected, a small proportion won't necessarily have detectable antibody, and we're learning more about that.
Understood.
But serology can also help us because what we're trying to look at is who infected
Dr. Chan, I
who.
might stop you there because
I'll take the point of order. You ask a question, the witness is being directly relevant. I'd ask that the witness actually be allowed to answer it.
All right.
to the point of order.
Yep.
I've allowed
I don't give a bugger how many questions you want to answer.
Trevor,
question.
Trevor, that's not helpful. Can we hear? I'll hear from Mr. Graham on the point of order.
You've repeatedly interrupted.
I have not.
allowed-
You have repeatedly interrupted the witnesses.
Forget again.
You have repeatedly
Could I
interrupted the
suggest?
witnesses.
I will call you to order, Trevor. I would appreciate it if you would allow John to respond to your point of order without interrupting him.
To the point of order, we've got plenty of material here. Dr. Chan has answered my question, expanded on the material that Health has provided. I now want to put a question to
To
the
the point of
Minister.
order.
No,
To the point of order, Chair.
I've heard the points
asked
of
to be
order.
heard.
I've heard the points of
I
order.
asked to be heard.
Well, no, I'm now going to rule on the point of
You're
order.
not gonna- you're not
No,
gonna
I'm
hear
not
me
going
at
to rule
all.
on the point of order.
She was midway through a
accept
sentence,
I accept.
midway through a sentence.
Allow me to rule so we can get on. I accept the point of order, but I would ask Dr. Chant, given the short amount of time, to bring this to a conclusion as quickly as you can, and perhaps you could explain what that term means as well in the course of providing your answer.
Oh, what?
Yes.
Serology.
But if you could bring it to an answer, because the member's quite entitled to go to a number of different questions. Dr. Chant.
So as the focus is on case finding in terms of finding out who transmitted it to a certain person, we use both testing, asymptomatic screening, and we can also use serology to assist. And that looks for cases that might have been infected a long time ago. The normal way your body responds to a virus is developing antibodies, and we have testing now that can detect it. It's got all of these tests have need to be interpreted with caution, and we work very much closely with our infectious disease and microbiologists in interpreting these tests, as we're all still learning about a lot of things to do with COVID-19.
Mr. Graham.
Minister, given the emerging situation in Victoria that my colleagues drawn attention to while interrupting your answer previously, are we considering using any of these techniques, particularly on the border, the very porous border between New South Wales and Victoria, rolling out mass testing including asymptomatic testing, to grapple with this current situation, this spike, as you refer to it?
Mr. Graham, I think you've just heard, although you did interrupt, Dr. Chant trying to explain that mass testing is not necessarily productive. And she's explained serology to you, but also genomic studies, genomic testing she hasn't actually explained to you. But each of these testing protocols are targeted to what public health physicians in New South Wales believe, and it's not just Dr. Chant, it's her entire team, are a more productive way of keeping us safe. So at this point, we'll continue following the advice from public health.
Minister, I just wanted to move on. The government announced a significant $250 million package to provide additional cleaning in schools, cleaning on public transport, cleaning in a range of methods. This was several months ago now. I'm informed that this is coming to the conclusion. Is it your advice going forward that that cleaning will need to continue?
Look, if you're associating it with monetary aspects, I'm not going to comment on that, but is it a general appropriate approach to be cleaning anywhere where the public are? Yes, and I would encourage, for example, we've got capacity now for us to return to restaurants and cafes. I was only telling Dr. Chant this morning that I'm a little concerned at this point, and asked her to have her team look at it, that perhaps some cafes and restaurants are not fully understanding the need for thorough cleaning between patrons. They have, in theory, they have a COVID safe plan, which they should have developed off checklists, which are available through the customer service website. I'm not sure that some of our smaller facilities understand the importance of cleaning, and I've asked her to look at that, because it doesn't matter where you are. I know I've certainly been in coffee shops and restaurants where nobody's put, mind you, it wasn't here last time when I appeared before this committee either, so we're all learning, but this is crucial.
I think you didn't appear with us. You were in your own facility last time.
Time before that.
Yep.
When we walked in, in fact, as I walked in, the Secretary reminded me that we had actually raised that issue, but it's here now.
Well, to be clear, you were in your own facility last time, Minister.
Budget estimates.
You were in
Budget estimates, sorry, not here for the PA, but budget estimates. And can I just remind you that it's necessary and wise for us all, when you walk into a cafe or restaurant, to have some hand cleaner available, either our own or preferably from the cafe. Use it. The table should be actually cleaned with disinfectant before you sit down. There needs to be a lot of cleaning done going forward until this pandemic is managed either through a treatment or a vaccine. Cleaning is crucial.
So cleaning needs to continue and will continue on public transport and in schools?
Cleaning is crucial in everywhere, everywhere where there are public usage.
Okay, I think we've got very limited time left, so can I just ask Dr. Chan if there was any update on the inflammatory disease in children that had started to emerge in the... Well, it's got symptoms that are similar to Kawasaki and toxic shock syndrome. I think it's got a very long title, but if you could just ask if there's any update either on the emergence of it in New South Wales or Australia, and what our response would be.
Pleasingly, it's a very rare disease, and Dr. Christine McCartney participates in a paediatric surveillance system across the nation, so that's been set up, and we've also contributed funding for that surveillance system. It's pleasing to see that we haven't got any cases of that in New South Wales. But obviously, as I said, it's a rare condition, but we are very well linked into experts at the National Centre and Dr. Christine McCartney, who's keeping us updated about all international developments.
Okay. And so
no cases locally at all?
No cases locally of that disease, that syndrome.
Okay.
Do you want to go and then back to court? Yeah.
Oh, no, I'll let you finish.
Can I just clarify, that's in relation to New South Wales? I'm commenting on New South Wales.
Okay. Are you aware of any in the rest of the state and, in the rest of the country? And is there any more developments? I know, I understand it's very rare. The reason why I raise it is because I've had it raised with me by parents that they were concerned about the emergence of it overseas, and so I just wanted to see if there were any more developments. I know the National Cabinet said they were going to look into it as well. There are no more developments?
There is no more developments other than there's been more published evidence about the outcomes, and our clinicians are obviously working with colleagues internationally to look at how, if we had a case, they would be most effectively treated, and it's pleasing to see many of the cases internationally have also recovered. So I think that we need to say we need to remain vigilant for it, and we have the surveillance system to continue to learn, but most importantly, our clinicians need to link in with clinicians internationally who are seeing it, so that should we end up with a case, we can offer the best treatment. But obviously we are also attempting to suppress COVID transmission to the lowest possible levels.
Okay, thanks, Dr. Chan.
Courtney, I don't think there have been any cases in Australia, because they haven't been brought to my attention, but do you think there have been? Or? Well, we check it out. We'll check it out and find out for you.
That would be great, thank you.
Yeah. Minister, my last question is again about the issue with Victoria. Given that Albury-Wodonga is very much sort of effectively a single economic, social, and in many ways a single health unit, are there discussions ongoing with your Victorian counterparts to ensure that if there is any decision made about boundaries or movement across the border, that there is, if you like, a bespoke, a specific solution for Albury-Wodonga, so that we don't see an arbitrary cut-off there? Are you sitting...
It's not just Albury-Wodonga. I mean, you've got Mildura just across from Wentworth.
Yep.
The border is a river, but it's not... I mean, people travel back and forth across all the time. So, and it's not in that area that is our prime focus at the moment. The Victorian Government is right to be focusing on the Victorian hotspots. And they've named the suburbs, and they include Sunshine, Keilor Downs. I mean, there's a number of different areas, but they're very clearly enunciating what those areas are, and they're targeting those areas at the moment. And I think it's fair for us to provide our support, work with them, give them all the help they need, but not to be jumping ahead, which is what, with respect, David, you're seeking to do. Sometimes in the health portfolio, it's wise it is to listen to Health Council and make decisions as is necessary, but there's no decision that has to be made on that at the current time. We're waiting for further health advice.
All right. Let's hope that Victoria's...
You raise an issue as to why it would make it very difficult to close borders between us and Victoria, because we have a lot of shared...
I'm not suggesting we race to that position, Minister. I'm glad it's been considered both public health and the economic and social impacts, but I'm asking if there's on-the-ground planning to ensure that we do have a specific solution to Albury-Wodonga and perhaps Griffith and Wentworth, if that planning is being done now. Mildura and Wentworth. If that planning is being done now.
As I said, we look at every issue every day, and at the moment, as Health Minister in New South Wales, I'm satisfied Victoria is doing its best. Not obviously getting good outcomes at the moment, but these things are what we're looking at today. And I mean, Dr. Chant might like to confirm this, but what we're looking at today is what happened possibly up to 14 days ago. So I think they need to work through those issues, and we're giving them all the support we can to work through those issues.
Dr. Chan, did you have anything to add?
Look, I think the situation in Victoria is clearly evolving, and we need to respond to the evolving situation. It's pleasing to see that we recognise as a nation that we need to support Victoria, and there's been expertise and other assistance provided to Victoria at this time, but also I want to acknowledge that Victoria is doing wide-scale testing. It's not unexpected that they'll find a number of cases through that, and to some extent finding the cases is actually positive, because you can then do the contact tracing, lock it down. What's going to be very important is what proportion of those cases were already in isolation at the time of diagnosis. Some of those issues will be the material that I'll seek urgent clarification of to form my view about the extent and scope of the outbreak in Victoria and whether it remains confined predominantly to the hotspot suburbs as identified.
Thank you, Dr. Chant.
And can I add that information is what, when they talk on the AHPPC for everything up to a couple of hours a day, they talk about those
That
issues.
granular information. Yep, that granular information.
That granular
about where the
information, which
materials-
then informs governments, in this case our government, of what decisions we might take. But it would be preemptive again to make any decisions until I've heard further from Dr. Chant after she's spoken to those particular clinicians, public health clinicians on.
I have one.
Yeah, now I'll just hand over to the
HPPC.
government if they have any questions at the end.
Yeah, no, mine's a more general question you were asked last time, particularly Dr. Chant, with regards to progress on the development of a vaccine. I know this is not directly within your gift, but you clearly got a better idea than most of us. Has there been any information that you've received as to how that process is going?
I think it's been amazing the amount of work that's being done internationally and the collaborative work and the speed of that work. So unlike with any other vaccine, there's the phase 1, phase 2, phase 3 trials are being pushed ahead quite quickly. There are some promising candidate vaccines, but a number of those are going into phase 2 studies. And we would await the outcome of those. Those vaccines are going to be most tested in high prevalence countries, UK, Europe, other America potentially. So those countries the vaccines are going to be evaluated. We'll get that data, and I'm confident that, as confident as I can be, that we are likely to get a vaccine. The time frame, I think, though, we need to be very cautious that the vaccine's got to then be manufactured. We've got to, have a successful vaccine, and there's lots of candidate vaccines. I think there's well over 100 different approaches to vaccine development occurring in various phases. We've then got to have the manufacturing plants to be able to manufacture it at scale, and you can imagine there'd be international demand for such a vaccine. We've then got to administer it to a significant enough of the population. So in realistic terms, if I'm the most optimistic, I really can't see that we will have a vaccine that is scalable until sometime in towards the end of 2021. And so
That's not the right answer.
So I think that one of the lessons for us is that we will be living with COVID for a long time, and therefore it's really important that we do fundamentally change the way in which we interact, the way in which we adopt and maintain social distancing, the way in which businesses and workplaces. And can I actually say that whilst there have been many negative aspects of COVID, we have seen how effectively we can suppress flu. We have seen successfully how we can reduce gastroenteritis illness and a number of other illnesses. So if we can actually perhaps even in the COVID, beyond the COVID period, maintain some of those behaviours, we will also have accrue the health benefits.
Can I add just to really, I mean, you've just got the health advice. I think the practical issues are that there's never been, ever, a human coronavirus vaccine. So I think what is giving Dr. Chant hope is the fact that there are so many teams working around the world to do what's never been done before. But
100 different rods in the fire.
Yeah. But there's also some other work going on that might, I mean, we've got some work, the BCG I announced last week or the week before. For those of us, perhaps nobody at the table except me is old enough to know about that, but BCG was used as a vaccine for tuberculosis. It was first formulated in 1921 in France, came here in 48, and in the 50s and 60s it was used to broadly vaccinate kids against tuberculosis. There's now a study going on involving the Murdoch Children's Research Institute and being funded by, I might add, is it Minderoo, I think, the Forest Foundation and others, including the Health Services Union. They put in $350,000 of their own money, which is amazing coming from the union, to be prepared to do that and support us. And we're having up to 500 health staff who are volunteering, being inoculated with the BCG vaccine to see if it acts to effectively minimise the effect of any potential COVID. So there's a lot of work going on that's already looking at some established vaccines as well that might or might not have an influence and effect on the eventual outcome. So I think it's probably best just to say we all remain enormously hopeful, but you've got to be realistic and say it might not come for a long, long while, if ever.
Ms. Watt?
Thank you, Chair, with your indulgence. I just wanted to thank you, Minister, and all of your frontline staff and everybody out there that's not appearing today for guiding New South Wales through this crisis. And in our indulgence in here and some of our differences, we tease out some of the issues, but overall we have managed this and you have managed this spectacularly in a deadly, deathly disease. And I just want to thank you for the, no doubt, 24-hour days you and your teams have been doing, particularly those people at their front line. And also I was intrigued by the medical graduates, the fast tracking of the med students into ICU training and that innovative approach that you've taken. It's more by way of comment. I'm being indulged, I know, but those sorts of quick, reactive, responsive ways of getting people out there has been extraordinary to watch, and I'm just very grateful that we are here in New South Wales and not in other places interstate around the world. And I just want to thank you and ask that you convey our thanks to your teams for the incredible work they've done. Thank you.
I just asked Madam Secretary to respond to you on that one, because I think she should say a few words on behalf of her team.
Thank you. Thank you very much, and it's been an extraordinary time for us collectively. It's an overused word, unprecedented circumstances, but the response from the health system has been quite remarkable because we had to change our operating model nearly overnight as public health came to the fore, led by Kerry Chant. The establishment of the operations centre at Homebush, led by Susan Pearce. Nigel obviously played an extensive role in managing PPE, and there's not a part of the health system didn't need to change the way it did its business. And digital came to the fore during the period. There was a significant shift in the way we normally conduct our business. Lots of video conferencing for staff to stay connected, and also patient consultations were changed. So it really is remarkable. Telehealth is the other term we use for it, as whispered by the Minister, not very softly. But we really had to change the way we delivered services, and the response from all the system has been extraordinarily remarkable. I think one of the successful things also was engaging the clinicians more extensively. We formed a COVID clinical council, and there was lots of clinical communities of practice that really assisted us in the decision making, and that's what I think one of the foundational strengths of our response has been. But we recognise that we're not out of the woods yet. We are still will continue to be operated in a COVID preparedness way because it can change very, very rapidly, but we're confident that we'll be able to respond if necessary.
I think today you've also referred to 4 or 5 different collaborative committees that have been across Australia and across the state. Yeah.
Numerous groups coming together
Extraordinary.
and working in a very collaborative way. Can I just add, going back in March, it's fair to say everybody was scared, very scared, and we didn't know where it was going to go. And I have to say to you, while we talk about the senior staff, the clinicians, the nurses, the doctors, it's actually much bigger than that. The entire health system. Frontline cleaners were really worried. We had a first International Cleaners Day celebrated a couple of weeks ago with the Health Services Union, and to listen to those cleaners talking about how they were worried in the early phase and how they had to become more familiar with PPE and make, just do all the extra work, the deep cleaning that they have to do. The admin staff have had to change the way they do things. Everybody, the security staff have had to change the way they do things. The entire health system from top to bottom has been extraordinary, and I actually think that I'm very proud to have actually been a minister for it.
You finished? Yep.
Although I probably prefer that I wasn't the minister for it.
Not sure it's what you knew what you were signing up for.
Yeah, may you live in interesting times, Minister. Minister, thank you very much for your evidence today. Ms Pearce, Ms Coff, Dr Chant and Dr Lyons, thank you all for your evidence and your work. I think if there's one thing we can take from this dreadful pandemic, it's we should listen we should listen more clearly to those public health officials and advice, not just in response to pandemic, but to a number of the issues that are in front of us. Public health advice is often given a secondary response to that more clinical and directed hospital care. But I think we've been enormously well served by our public health officials. So,
Can I just say something on that, David? And that is this, that there has been some criticism I've seen in various forums of public health doctors and not making right decisions. Can I just say to you that the public health doctors in New South Wales are extraordinary. Their application is extraordinary, their commitment is extraordinary, but when you're in a 1 in 100 year pandemic with things going absolutely insane around you, sometimes it's very challenging to make decisions in that environment. So I just want to say, I for one as Health Minister am grateful for all the work they've done, and they should never think less of themselves if they happen to get something that they don't think is perfect that day, because after all, we are in a pandemic, and I think the broad community acknowledge that and thank them, and I want to thank them on the record. All the public health team have been unbelievable.
and we can't allow hindsight to be the basis upon which we judge decisions
Unfortunately,
in the absence of information.
that is in some quarters being seen to be the case, and I reject that out of hand.
Yeah. So, Minister, again, and to the witnesses, thank you. That concludes this morning's hearing.
Thanks very much, folks.